Hello friends, I am Dr. Indu Bansal, Director Radiation Oncology from Narayana Super Speciality Hospital, Gurugram. Today we are going to talk about esophageal cancer or the food pipe cancer. This cancer is not so common in India, but it leads to a very high mortality. In India, out of 1 lakh persons, 4 to 5 people are at risk of developing esophageal cancer. Esophagus is a pipe which runs between from the neck and it joins the stomach. So any tumor arising in this area is a food pipe cancer. Normally we divide this pipe into 3 parts: upper 1/3, which is known as the cervical esophagus, middle 1/3 and the lower 1/3 cancers. So the most common causes of cancer in this area are consumption of tobacco in any form, alcohol, and people who have a lot of acid reflux disease. They are at increased risk of developing esophageal cancer. Apart from that, people with Barrett's esophagus or with hiatus hernia, they are at increased risk of developing esophageal cancer. The most common symptoms of esophageal cancer are difficulty in swallowing food. It may be initially it is for solid food, then it may be for semi-solid food, or it may be even for the liquid food, and sometimes even the patient is not able to spit their own saliva. Because of this, the patients lose weight. Sometimes that may be the only presenting symptom. Patients may come with loss of with hemoglobin, less hemoglobin because of loss of blood through the food pipe, or sometimes they may come with pain in the chest or in the back because of the tumor. And sometimes patients may have coughing after eating anything because of the communication between the esophagus as well as the windpipe, and this is known as tracheoesophageal fistula. If the tumor has spread to the lungs, that patient may have coughing, difficulty in breathing, chest pain, or if it has spread to the liver, it may lead to weight loss, and sometimes the patients may come with bony pains because of tumor spreading to the bones. The most common ways of diagnosing this cancer are through blood workup, which is drop in hemoglobin, and there is a special X-ray which is done, which is known as barium swallow, where a color dye is given to the patient or contrast agent is given to the patient, and it outlines the irregular part of the food pipe. And upper GI endoscopy is also done, in which a video is inserted through the food pipe to diagnose the area where the tumor is present, and at the same time a biopsy can also be taken from the same area to confirm cancer and to find out the variety of cancer. Normally the most common varieties of food pipe cancer are squamous cell carcinoma and adenocarcinoma, but the rare varieties may be small cell carcinoma, sarcoma, or a combination of both, that is adenosquamous carcinoma. To know the extent of tumor, we do a CT scan of the neck, chest and abdomen to see the total length of the tumor and its spread to the adjacent lymph nodes or to the lungs or bones or liver. And similarly, a whole body PET CT scan with contrast is also done, not to just to diagnose the local extent of the tumor as well as its metastasis to any other part of the body. After we have diagnosed the cancer, then we do stage the tumor, and it's a stage 0 is stage 1 is the earliest stage, while stage 4 is the advanced stage. Sometimes we have to do a bronchoscopy also if we are suspecting a tracheoesophageal fistula, to find out that there is no connection between the windpipe and the food pipe. After the staging is done, then in stage 1 cancers, normally only surgery or early mucosal resection might be sufficient, but in stage 2 and stage 3, adenocarcinomas and squamous cell carcinomas, for both we have to do a combination of surgery, radiation and chemotherapy for middle and 1/3 tumors. For tumors of the cervical esophagus, the main treatment is a combination of radical radiation and chemotherapy, wherein the patient receives around 25 to 30 sittings of radiation along with weekly chemotherapy to eradicate the tumor. But for tumors of the middle 1/3 or lower 1/3, we try to give neoadjuvant therapies in the form of combination of radiation and chemotherapy, to shrink the tumor for we give it for 4 weeks to shrink the tumor and to get negative margins and to prevent the spread of tumor. And after giving neoadjuvant chemotherapy or radiation therapy, then we give a gap of 4 to 6 weeks for the tumor to shrink, and then the patient is taken up for surgery. If a patient has underwent a surgery straight away, then after surgery, if the nodes are positive, then patient may need chemotherapy, and in rare instances radiation may also have to be added. Although neoadjuvant therapies are better than surgery upfront. For stage 4 tumors, the main treatment is palliation. We may add radiation to relieve the symptoms and to allow to make the patient eat and to prevent bleeding, and sometimes we have to put in a stent which is known as esophageal stent, so that the lumen opens up and the patient is able to eat food. In certain situations, we have to put a tracheal stent if there is tracheoesophageal fistula, to prevent the food passing from food pipe to the lungs and to prevent aspiration pneumonia. Radiation is also used as a palliative modality to relieve the patients with symptoms of bony pains due to bony metastasis. So it's very, very important to diagnose the tumor early, because these tumors are unfortunately diagnosed at a late stage and they have a high mortality or death rate. So it's important not to consume any of the causative agents like tobacco in any form. Please stay away from alcohol. Correct your acid reflux disease. Don't ignore any symptoms. Go to the right center at the right time and meet a team of doctors like a radiation oncologist, surgical oncologist, medical oncologist, nutritional therapist, physiotherapist, radiologist and gastroenterologist, and so that they all can work as a team, discuss your case in the tumor board and decide the best line of treatment for you and make you cancer free. I don't want any patient to die of esophageal cancer. So please stay away from the causative agents and stay healthy and take treatment on time. At Narayana Health, we have TrueBeam STX platform to take care of all the needs of patients with radiation, and it is a very effective modality to treat esophageal cancer.